Since 1970, Candela Corporation has been setting new standards of excellence in medical and aesthetic lasers. The Gentle YAG is yet another of Candela's many industry innovations. In addition to its unrivaled ability to permanently remove hair on all skin types and those unsightly veins of the legs and face, the Gentle YAG has also been shown to be effective treating skin laxity. In this program, you will learn the skin tightening treatment techniques for the Gentle YAG as developed by Dr. Mark Taylor, a board-certified dermatologist and founder of the Gateway Aesthetic Institute and Laser Center in Salt Lake City, Utah. Before getting started, you will prep the skin as with any other laser procedure, making sure any topical anesthetic used is completely removed, and ensure that the eyes are properly protected from the deeply penetrating energy of the Gentle YAG's ND YAG wavelength. In general, you will want to treat the entire face using the Gentle YAG's 10 mm spot at the following treatment parameters: 50 joules per centimeter squared fluence, 50 millisecond pulse duration, and DCD set at 40-20. You will want to ensure that the post-laser pulse DCD spray is set at 0. As you can see, you will want to deliver the laser pulses in roughly an Olympic ring type of pattern with minimal overlap. The handpiece should be held perpendicular to the skin with the distance gauge lightly touching the skin so that the cryogen is properly contained before each laser pulse. 3 consecutive passes are critical to the success of the treatment. The recommended procedure is to treat areas of the face in consecutive passes in alternating directions. Here, the right cheek is being treated first. The laser pulses are initially delivered vertically, then horizontally, and finally diagonally. The clinical endpoint of the treatment is general erythema, and the skin is warm to the touch, which should be checked regularly during the procedure, as should patient comfort. After 3 passes are delivered on the right cheek, treatments typically continue to the opposite side of the face, then the neck, and finally the forehead. Treatments proceed rapidly from one area of the face to the next. Total procedure time for the entire face should approximate 10 to 15 minutes. Treatments may be tenderer along the jawline. You may have to pause slightly or have your assistant put a little pressure on the skin as the treatment progresses in this area. It is important not to go over anything that may absorb the 1064 nanometer laser energy emitted by the Gentle YAG, such as tattoos, vascular lesions, and hair. Men receiving this treatment should be cautioned that permanent hair reduction is a potential consequence of treatment. As can clearly be seen here, one of the clinical endpoints to the Gentle YAG skin tightening treatment is observable erythema. This is one of the indications that sufficient temperature is being achieved to stimulate tightening of the collagen. The chin area can also be treated, although some patients may feel some discomfort in their teeth when treating in the paraoral area. To protect the teeth, wet some gauze, roll it up, and place it in the patient's mouth between the lips and the teeth. Proceeding down on the neck, continue to use the same protocols as outlined before: 50 joules per centimeter squared, 50 milliseconds pulse duration, and 40-20 DCD. Most patients tolerate the procedure fairly well. Fluences may have to be lowered slightly to 40 joules per centimeter squared, depending on patient discomfort and the relative thickness of the skin in this area. However, if the patient can tolerate the fluence at 50 joules and no adverse reactions are observed, you may treat the entire neck area down to the clavicle. As always, be attentive to the laser tissue interaction. It is important to avoid any vasculature of the neck, as the laser energy may cauterize vessels at these treatment parameters. 3 consecutive passes in alternating directions is the recommended procedure for the neck. For most patients, topical anesthetics are all that are required to ensure treatment tolerance. Oral analgesia, such as Percocet or Valium, may also be prescribed at the discretion of the treating physician. While response to any laser treatment varies from patient to patient, and some patients may show dramatic results with lower fluences used or less passes made, The best results are observed when enough heat is deposited to actually shrink the collagen and tighten the skin. Because of the bony protuberance of the forehead, fluences generally have to be reduced to 40 joules per centimeter squared when treating this area. Again, notice how quickly the procedure is progressing over the entire face. Continue to zigzag back and forth to help overlap the round pulses of the laser. It's important to stay at least 1/4 of an inch above the eyebrow. Also, be sure to point the laser away from the periorbital area of the eye. Do not fire the laser underneath the eye shields. Aim the handpiece away from the orbit when treating in this area. Another technique to increase patient comfort is to have an assistant put pressure on the skin right after the laser pulse. This can greatly minimize the discomfort of the treatment. The nose can also be included in the tissue tightening procedure. Adjunct benefits of the gentle YAG skin tightening treatment include reducing pore size, increased light reflectance of the skin, and overall improvement in tone and texture. At the end of the treatment, one can expect mild to moderate erythema and edema. The redness and swelling will resolve quickly. Avoid applying ice immediately post-treatment, as cooling the skin dissipates some of the heat necessary for collagen contraction, compromising treatment efficacy. Most patients can put makeup on and go back to work immediately following the procedure. Typically, 5 treatments are all that are recommended, spaced 1 month apart. In addition to the gentle YAG, Candela provides lasers and light-based devices for improving the appearance of skin and the treatment of a wide variety of conditions, such as port wine stains, acne, warts, psoriasis, vascular and pigmented lesions, and tattoos. For more information on the gentle YAG or any Candela system, please contact your local sales representative or contact Candela at 1-800-733-8550 or visit us at candelalaser.com.